Hi, my name is Joe Bellick, and I'm the founder of Bellick Law, LLP. We are proud sponsors of the Mesothelioma Research Foundation. We have been honored to do this work for 25 years, representing people with mesothelioma and their families. And part of our commitment to our clients is to give back and sponsor research and advocacy efforts and engagement across the mesothelioma community.
Hi, I'm Trey Branham. Dean Omar Branham and Shirley is proud to sponsor this year's Mesothelioma Applied Research Foundation Conference. The 34 lawyers at Dobbs have more than 400 collective years providing legal representation to victims of this insidious cancer. We applaud the leadership of MARF and this community for its tireless dedication to finding a cure for this totally preventable disease.
At MRHFM, we exclusively help mesothelioma patients and their families. It's all we do.
This is why we are proud to sponsor the Mesothelioma Applied Research Foundation and its work to fund mesothelioma research and provide support services and education for patients and their families.
Welcome to this episode of MesoTV. Today I have with me three caregivers, Cynthia, Bob, and Elaine. They are all amazing people who care for partners with mesothelioma. Our topic for MesoTV today is caregivers. Caregivers are a vital part of the patient's cancer journey. I'm going to start today with Cynthia, whose husband is diagnosed with mesothelioma. If you could tell me, Cynthia, how you felt when you first heard that he had cancer, what was going through your mind?
Shock. You know, when you reach a certain age, you think you can handle almost anything. You've been through a lot in life, and you also have made plans. We had plans, like serious plans, things we'd saved up for our whole lives, and then you hear cancer. And in that conversation, I was in so much shock, and it was almost a little gift that my brain kind of almost shut down for a minute, and I heard this message in my mind, not like a voice or anything, but just a knowledge that this is your life now. Your life script just changed. Wipe it out. Everything you thought was going to happen, rethink it. Because it may happen, but everything's going to be based around, it's a terminal disease. When you're told it's, what? He's healthy. He has 15 months. Shocking. After the initial shock, one thing I did is I looked up the Mesothelioma Applied Research Foundation. I started doing research. I have a doctorate in educational policy and administration, which isn't the only thing I've studied. For 20 years, I've been in school, more than 20 years, and teacher and all of that. And I just thought what's important is to look up what other people are doing, who has this, how it's affecting them, and try to make some good treatment decisions and understand what to do. And you're still in shock. I mean, I'm 2.5 years down the road now, and I can look back and say the first year when I thought I was really becoming, a knowledgeable caretaker with all of my research and everything, I still needed help so bad. It's so devastating, and I wouldn't have made it without the group, the Meso group. The Meso group, I wouldn't have made it. I would have run away. I wanted to run away. I mean, not really, but
yeah,
it's my life has changed, and you accept it with love. You have to. I don't know if that's a good thing to say, but you have to accept it. I did research, and I found that it's very rare, and you must listen to people who are in the field doing it now, that know what they're doing. It's very, very important that it's so, with a rare disease, it's been very challenging for us, because even with the research, there have been times that literally an oncologist said to me, I do not know what to do. And I realized you have to go to an oncologist that deals with meso, you know, and that's really been helpful for me to study that and to study it online and be careful. And ask Julie White about things. I'm serious, because you know, they'll say anything on the internet now to sell some things, and you're vulnerable. You become extremely vulnerable to professionals and to the medical community and the healthcare community, and they speak to you with a lot of authority. And sometimes the authority that they speak to you with is for the general public that doesn't really understand what to do, and maybe generalizing in a way that isn't really for you. And you don't know that until you study it, and you study what different people are experiencing and different specialists are doing, that you realize, well, no, that isn't the best treatment for him, maybe. Or just those kinds of thoughts are extremely difficult to think through. I tried to do this on my own, and I really did a lot of research, NIH, everything read and everything. You can't. It's too complicated. It is extremely, and it's evolving rapidly. So I am very grateful that I had help, because I couldn't have done it without. You have to do the research, and then you have to get the help, the insights, the current pulse on what's going on with meso treatment. And that's what we do. That's our life now.
I think it's amazing that you're able to use your life skills as in your career as to help your husband, and one of the amazing things about Caregivers is that you can be there and advocate for the patient when they can't do it for themselves. And I think you're right that there's a whole lot of information and you can fall down rabbit holes, so it is important to find those reputable sources. So well, thank you for sharing that with us. And I wanted to move to Elaine and briefly ask you, Elaine, about feelings. You're a caregiver for your husband, who's also diagnosed with mesothelioma. Can you tell me about the feelings you have experienced as a caregiver?
Well, I have to say that in terms of caretaking, there isn't really much I can directly do for him. He's very independent. Loves doing things himself, and being ill, he wants to have even more holding of the reins. In cooking what dishes he likes to eat, I don't really find areas to directly help him. Like, can I run you a bath? No, I don't like baths. That kind of stuff. But I've had feelings of guilt and frustration about not doing enough for him. He doesn't want things done for him. I was putting on a brave face at first, as in, quote, he's the one that's sick. I'm just fine. You know, I'm not sick. I'm perfectly healthy. I'm strong. However, I recently came to understand that I'm not so fine. And the feelings of helplessness have kind of insidiously invaded me in many ways. Which affects our communications and makes me feel an anger toward him and the disease, as in, why can't I make this better? You know, why can't I? Getting adjusted to being okay with not being okay all the time, like not wanting to be cheering up other people all the time. At first, tons of people, you know, responded and came calling and coming over and blah, blah, blah. And bolster their spirits and keep yourself together, right? Find your own center, I think. Sometimes he doesn't follow treatment recommendations, and watching this, I find the angry feelings just overwhelming, you know. Why can't you? Can he just do what the doctors recommend? But I know he needs to have a sense of control again and about the disease. And once I remember that, I kind of calm down.
Makes sense. I think those are all really common feelings among caregivers, the pervasive sense of helplessness, especially that there's nothing you can do and you want to fix it. So when you love and care for someone, it's hard. We talked a little bit about how independent he is and how he likes to do things for himself, so that he remains that sense of control. Do you have any advice on how a caregiver could communicate effectively with their loved one without seeming overbearing? And
I found one of the most difficult things for me personally as a caregiver and in life is just to be quiet and refrain from making what I think are helpful suggestions, and let him find his own way to deal with things. As others have mentioned, taking care of myself, doing my exercise, seeing my friends is very helpful. Waiting, yes, me for help and advice instead of barging in and again trying to fix things is a good lesson for me to try and remember.
Makes sense. Yeah. Bob, moving over to you.
Yes,
You're
ma'am.
a caregiver to your wife who has mesothelioma, and she's had 2 cancers. She's currently battling mesothelioma though, and you've been a caregiver on and off to her for 11 years. Could you speak a little bit about this journey with us?
Yeah, our journey together started 11 years ago with ovarian cancer. Sheila's going to interrupt me because she might say it was 12 or whatever. Please don't interrupt, honey. Okay. Yeah, it started 11 years ago with ovarian cancer. And like the other caregiver, I did some tremendous research on that, interviewed some specialists, and ended up at MD Anderson and found one of the greatest gynecological surgeons. He was famous all over the world. His name is Pedro Ramirez, and he gives conferences and studies all over the world. And he took Sheila and I in as a patient. And over these 10, 12 years, he has actually saved her life. And through his research with ovarian cancer and constant changes there and medications and so forth, I had to go through, as a caregiver, started out with all her radiation problems and chemotherapy problems, from the vomiting to diarrhea to 7 different major surgeries, which had huge home care requirements from me. She had an ileostomy surgery during those times and had to have a stoma. And that required huge nursing care from me, lots of medical equipment that I had to bring into the home and take care of her stoma. And we did that for 4 months. And with that, obviously, I did have taken over all the chores that Sheila used to do, all the nutrition food for her, all her medications for her, 100% of the cooking, 100% of the shopping, 100% of really all her requirements. And she really had some bad health problems that needed my attention at night, and probably have called 911 5 times during this period to take her to the ER. And so as a healthcare provider for Sheila, when we can get into it, I think in one of the sessions coming up, mentally, it's exhausting and it is straining, depending on the type of care that is required. And Sheila's had to have some extensive care by me. And at 70 years old, I could do it. At 81 now, I'm still, God blessed me to be healthy at 81. I still can go to the gym. I can still go play golf a little bit. I have now help coming in from friends and family. I have a full-time gardener now. I have a housekeeper now. I hired chefs for seniors to come in and make meals for us. And so I've gotten those things that would relieve a lot off of my requirements for Sheila.
So you so now you said she started with the ovarian, then you made it through that, then she was diagnosed with the mesothelioma. Now you're
just this last December.
Just last December. And that was a shock. The other caregiver, talk about a shock, I could relate to her, because this disease, and she's a wonderful researcher, from what I understand, this disease is so rare, these doctors don't know what it is. She's had 4 collapsed lungs and fluid all over her lungs, and they don't know what it is. They just blamed it on ovarian cancer.
Yeah.
Oh, this is from the ovarian cancer. Well, and 3 months later, she's in the ER again with her lungs being drained and stomach blockages. And I can't blame these doctors. And it wasn't the MD Anderson doctors. These were local doctors that now Texas Oncology we've gone to. These doctors don't know what this disease is.
Again, it speaks to the need for an expert. And I think, sort of summarizing what you've been talking about, you really researched. I remember you telling me at one point you were watching, was it YouTube videos to learn how to do stoma care?
Your ileostomy surgery.
Yep, ileostomy care. Yeah. So I mean, you've really been dedicated, and you told me that, you know, at sometimes you had realized when you were getting tired and frustrated, you might get a little cranky, and then you realized that you
Sheila's turning around. Yeah, I can get a little cranky. It mentally, being an extensive caregiver can mentally drive you. And you have to really be a strong individual. And and I lose my patience sometimes, and I can lash out at Sheila, and then I feel terrible, you know, and then I just feel terrible that I did. And I go in and apologize and hug her and tell her I'm so sorry, you know, and she apologizes to me that she has to put me through this.
Then you said you realize that it's time to make sure you're still doing the things that you need to do to take care of yourself, like going to the gym, making sure that you're playing golf, doing the things that you do to take care of yourself. And I think Elaine spoke to that too, making sure that as caregivers, you have to take care of yourself so you don't get what's called caregiver burnout. And if you don't take care of yourself, you're not going to be good to anyone else. Like they say when you're on an airplane, if it's going to crash, you put your own oxygen mask on before you do anyone else's, because physically, mentally, if you're not making sure that you're okay, you can't make sure anyone else is okay, especially for something like 11 years. That's a long time.
Yeah.
And you've got to make sure that I had a patient, a caregiver one time tell me that she was taking care of her husband and his special diets. And she said, meanwhile, I've been gaining weight. My blood pressure is going up. I'm not doing well and I find myself getting resentful, but then I'm feeling guilty because I'm resentful because he's sick and he can't help it. And I said, well, you need to make sure that you're taking time and making meals for yourself as well. So that's something very important, isn't it?
I think that's a very good point. Yes.
Yeah. Caregiver needs to care for themselves as well. Yes. So
absolutely.
Yeah. So I'm glad to hear, Bob, that's one of the things that, you know, you've been able to maintain is taking care of yourself and also getting people in to help and not feeling like you have to be there every moment as long as someone is there.
And it's a great relief for me that now we do have family and friends that will come in and relieve me.
Yes. That is all very important so you can maintain that role. I wanted to ask each one of you if you could give advice to a caregiver who's just starting the journey. What would that piece of important advice be? I'll start with you, Cynthia. What would your advice be? I know there's multiple things you could say, but if you had to say the top thing you would say to somebody who is just getting started, what would be the thing you wanted to get across to them?
Have faith and practice love as deeply as you can. There is no alternative. There's simply no alternative. You simply love the person. It's time just to love them. Nothing else matters. This is my second time. My mother passed away. She was diagnosed with lung cancer in January and died in my arms on Mother's Day the same year. So I have the history, the experience that nothing mattered except being with her. Once I was told she was going to die, I told myself that, but I didn't do it as much as I am doing it now.
Okay.
And
spending that time.
I learned my lesson that what's more important is just the two of us just sitting next to each other sometimes. We just sit together in the backyard, just sit there.
So the quality time, yeah.
Quality time together and really think about what medical decisions you're making and question if that is quality of life or not.
Okay. Great. Elaine, how about you?
I just wanted to mention, he said to me this morning, I'm so sorry you have to go through this and watch me. And I just felt so sad, you know. I don't feel that way, as if he's a burden. So I think it's important to be patient with ourselves.
Yeah.
And that we might have all kinds of reactions. Some of them might be unpleasant. We're not used to having unpleasant reactions, you know, especially if we're, you know, nice people. You don't have to be so nice. I would say wait and let your patient, him or her, ask for help. And if you're a loved one who typically doesn't ask for help, you could offer simple things that might make their day easier if possible in the pillow. Lotions, things like this. And remember, any feelings you have that may seem outrageous or out of character for you are normal in this non-normal situation. Right?
Makes sense. I heard Bob say the same thing, that his wife apologized for having to put him through it. So I think that's a normal patient feeling.
One more thing is, don't be afraid or ashamed to have your own therapist if you need it. It's not a bad thing. It can be very supportive. It doesn't mean you're crazy. You know, people are there to support you, as Cynthia says.
You're going through something as well. Yes. Bob, what was one thing you would like to say to a new caregiver?
I think, depending how dramatic your life changes, there's going to be some very good times and there's going to be some very hard times. And I think your love is tested. We've been married 60 years. We were high school sweethearts. And we will be celebrating our 61st. And I think, and I would say, if you don't have unconditional love for your spouse who is going through these terrible medical problems, you're going to have some real hard times mentally. But if you do love unconditionally, that's going to get you through it. That unconditional love that you've maintained for 60 years. Now, we've certainly had some hard times during those unconditional love times.
Sure.
You know, but every marriage does. Some of them make it, some of them don't. Ours did, because we both have loved each other unconditionally. So the last thing I would say, your love for your spouse, if you're going through some really hard medical problems that need your constant nursing care, and I'm talking about getting up at 2 o'clock in the morning, getting up at 5 o'clock in the morning, making her bed, and or if she falls, trying to get her up. If she can't make it to the toilet, get her to the toilet. And if she can't make it to the toilet, do you help clean? Yeah, you go in and help clean the mess. And if she needs a shower at 3 in the morning because of the mess, you put in the shower with her. There's some things that your love is going to be tested.
Some of it's not pretty, right, Bob?
It's not pretty.
Yep. You know, I just want to thank you all for sharing your experiences, and let all caregivers who might be listening today know there are resources available for caregivers. As Elaine said, getting therapy is important. Also, we have resources at the Meso Foundation for anyone who is interested. And thank you all today.
Well, thank you very much.
Thank you.
Thank you.
I hope this helps.